And even when I don't feel like I should keep going, I stop and think of you, and it gives me the boost I need to carry on.
Sharon Richmond sharing the letter her son Vincent wrote her the last Christmas he was alive. Barbara Senna is another Long Island mom who's lost a child. She carries a part of her son Michael with her every moment of every day.
And he did not want to be a drug addict, and I just feel the system failed us so badly.
Two families shattered, now turning loss into a fight for change.
There are people dying every 15 minutes. 197 die every hour. Like those facts, how could there be such non-action from our government?
Vincent started experimenting with OxyContin after high school. It soon became two battles: Vincent's battle with addiction and the never-ending battle with the insurance company.
They only covered the 3 days. They would not cover inpatient.
Michael was 20 years old when he tried Oxy for the first time. He later moved on to heroin. He was treated in at least 8 different rehab facilities or sober homes, 3 of them out of state. And quickly he learned it's a complex and difficult journey to get off drugs. Rehab is a $35 billion a year industry. There are 13,500 drug treatment facilities nationwide, but there are currently no federal standards for rehab programs or sober homes. The nation's opioid crisis is big business.
My son learned so many bad things there. There's got to be more monitoring and control.
Dr. Jeffrey Reynolds is on the state's heroin and opioids task force. He says these facilities lack regulation and oversight.
The problem is the treatment isn't very good, the price tag is very high, and families who would pay anything to save their kids' lives are being duped left and right by these marketers.
Facilities advertise beautiful places, but critics say there is no rating system and no empirical data to back up alleged success rates. So-called brokers have also become a part of the industry. They serve as middleman. Although legal, they're getting paid by facilities for the number of new patients they bring in.
I was driving home from the hospital when, they kicked him out, and I was like, I didn't know what to do, and I heard a radio station saying, we can help you if your son's an addict, and I called them up, and they shipped him out to Texas.
After Michael returned from Texas, Barbara says the broker would check in to see if he needed treatment again. And when he did, the broker sent him to a facility in Florida.
It is cold calling. And then, then he gave my number to somebody else, so somebody else would call me.
A lot of these are boiler room operations. They're paid when they make those referrals. It's usually between $3,000 and $15,000 for every person you deliver.
Barbara's son had just left a sober home when he overdosed in Florida. For Sharon, after the insurance stopped paying, she brought Vincent home, where several months later, he OD'd. And now she's taking her fight to Albany. She wants lawmakers to force insurance companies to comply with an existing 10-year-old federal law requiring substance abuse to be seen the same way as medical illnesses, paying for more treatment.
They say they're committing themselves and they send their condolences, but at this point, I don't want condolences. I need action.
What both families have learned, everything about the drug treatment industry is difficult to navigate and expensive.
Way over $100,000, way over. And honestly, I would spend it again if my son was still here.
If the insurance system wasn't broken, do you think your son would be alive today?
Absolutely. There is no doubt in my mind.
I'm Shirley Chan for Pix 11 News.